Dear friends, in this course on social welfare and social legislation, we have previously seen the position and circumstances of prostitutes in Indian society. We have also looked at the important provisions of the Immoral Traffic in Persons Prevention Act of 1986, which deals with traffic in persons. In this lecture, we would be looking at the effectiveness of the ITPPA, which is the Immoral Traffic in Persons Prevention Act, and we would also be looking at alternative approaches to dealing with the menace which prostitution has become for the people practicing it. The Immoral Traffic in Persons Prevention Act 1986 sought to radicalize and change the law dealing with immoral traffic in persons in India. However, it was often felt that it introduced cosmetic changes to the earlier enactment, and it remained heavily biased against the prostitute. Through sections 7(1) and 8(b) of this act, it continues to penalize the prostitute for prostitution in a public place or for soliciting for the purpose of prostitution. Unfortunately, the client is not viewed as an offender under the Act. It would seem to anyone that if the prostitute is doing a wrong act, so is the client. Does it look like that this is an example of a patriarchal society which believes that it is the woman who is wrong for luring the man, and the man is unwillingly trapped in the situation? As examined in section 1, the legal status of prostitution is slightly ambiguous. The ITPPA is aimed at preventing trafficking of persons, but it does not prohibit prostitution per se. According to section 2A of the ITPPA, the keeping or managing or any form of assistance in association with a brothel is an offence. However, the Act does not prohibit a single woman from practicing prostitution for her livelihood. This rarely happens, since most women and girls operate within the brothels located in red light districts in the cities. Therefore, it can be suggested that sections which criminalize the activities of the prostitutes should be deleted. This would also prevent situations in which the prostitutes are forcibly harassed by the police. Decriminalization should extend to include all categories of prostitutes. Let us now look at the issue of decriminalization of prostitution. Decriminalization of prostitution means the complete renewal of sanctions against the prostitute. Historically, women's movements have been opposed to the institution of prostitution. The sex workers have been perceived as both victims and villains. It has been argued that they have no real choice because of their situation of poverty. However, the prostitutes themselves reject being treated as symbols of oppression and demand recognition as workers. Decriminalization has been proposed as a model which would take into account the needs of the sex workers, since it is founded on the fundamental notion that sex work should not be seen as being intrinsically different from other work. It would also help to wipe out the stigma of immorality and criminality. For example, in New South Wales, the decriminalization of sex work has resulted in a strong sex workers movement. Therefore, decriminalization can facilitate the unionization of prostitutes for welfare facilities and better working conditions. An important distinction should be made between decriminalizing the prostitute and decriminalizing her institution of prostitution. In this regard, it is proposed that although the former is necessary, the latter might not be as acceptable. The regulation of third-party managements is necessary to abolish the use of force, coercion, and violence against the prostitute women. In pursuance to the argument of decriminalization, it is recommended that dominant legislations which victimize prostitution should be reviewed and provisions which penalize or discriminate against the prostitutes should be deleted. This should not affect the stance against trafficking to ensure that criminal sanctions are enforced against prostitution rackets as well as clients whose acts violate prostitutes. Let us now look at the issue of legalization of prostitution in India. In light of the burgeoning problem of the AIDS epidemic, proponents argue that legalizing prostitution can ensure that the AIDS spread is contained. According to them, the legalization would entail registration, licensing, and methods of identification of sex workers along with regular health awareness programs and measures to curb the spread of sexually transmitted diseases and AIDS. However, a few activists are skeptical of this view. Legalization of prostitution is advocated by another group who maintain that prostitution is a necessary and inevitable social evil which will continue to exist in society, and its legalization is necessary to prevent the breakdown of family structure and prevent rampant rape. However, this argument has been severely criticized in recent times, since it rejects the exploitative socio-economic and ideological roots of prostitution. Let us now examine both the positive and negative aspects of legalization of prostitution. Is prostitution truly a universal necessity, as some people argue? The proponents of the view that prostitution is a universal necessity claim that the man's sexual drive is naturally and biologically aggressive. Prostitution is perceived as a recourse to give vent to the sexual urge of men and to allow them to dispose their undesirable sexual frustrations. However, this has been proved to be a historical untruth. Our patriarchal society has equated sex drive with male sexuality, which is erroneously assumed to be naturally active and aggressive. In opposition to this, women are perceived as passive sexual beings. Furthermore, it is also incorrect to believe that the abolition of licensed brothels would lead to an increase in rape of women. In countries like the USA and Nicaragua, the abolition of licensed brothels did not lead to increase in sexual offenses. Rape continues to occur even in those countries which have legalized prostitution. Therefore, to advocate legalization because it is supposed to protect the family structure conserves the patriarchal and exploitative status quo of our society. This view endorses the oppressive bias of the patriarchal family in modern society and promotes dual standards of morality for men and women. Let us now look at the issue of legalization. Could it be a panacea to cure the AIDS menace? Prostitutes have been accused for being the source of sexually transmitted diseases, and their social and economic control has been justified to ensure the maintenance of public health. The government has been proactive in their efforts to preserve public health without showing adequate concern to curb other health problems faced by the prostitutes. Society often assumes that the prostitute is responsible for the transmission of sexually transmitted diseases, and most policy measures framed are directed towards her. Here, the role of the client as a career is denounced due to widespread sexist biases. The lack of preventive or curative health measures prescribed for the client cannot affect a curb on the sexually transmitted diseases. An impending concern for prostitutes in India is the HIV/AIDS menace. In Mumbai, there was a rapid increase in HIV among the sex workers, and it could not be controlled effectively because the sex workers in Mumbai were not organized. In the state of Kerala, the state government health department initiated an intervention program to promote safer sex and also organized awareness programs. Similar initiatives were taken in the Sonagachi red light district in Kolkata, where they formed sex workers groups and trained peer educators. In areas where the HIV prevention program has been successfully implemented, the prevalence of sexually transmitted diseases and AIDS have been reduced. It has been reported that sex workers do not always practice safe sex since clients refuse to use protective measures. The women cannot put up a resistance since they do not have the bargaining power to negotiate. According to one view, the legalization of prostitution will ensure that prostitutes are licensed and registered, and their activities can be closely monitored and controlled. In a legalized system, the conditions under which sex work is allowed is defined by law. If sex work happens outside law, it remains illegal. Holland, where sex work was legalized in 1999, serves as a good example of the positive and negative aspects of legalization. Under the new legal system, local authorities have been given the power to determine the condition and areas where sex work should take place. They also regulate the working conditions of the brothels. This has resulted in the significant improvement of working conditions of sex workers. The negative aspect is reflected in the fact that many sex workers who are underage or illegal migrants are unable to obtain a license. Therefore, they are forced to move underground and are vulnerable to abuse and bad working conditions. Many feminists also support the view that licensing and monitoring would not help the sex workers to live and work with dignity. The segregation of prostitution would also isolate, identify, and label prostitutes, destroying their private identities. In the Indian society, where sex work is stigmatized, policy reforms could push a large section of the sex trade underground, especially those who do not want to be known publicly as sex workers. Let us now look at the human rights approach towards prostitution. In recent years, there have been several successful intervention programs undertaken by NGOs and sex workers groups which work in close association and involvement with the communities of sex workers. Sangram, operating in Maharashtra, is one such group, which was founded in 1992 with the object of empowering women in sex work to create a sustainable response to the HIV pandemic. The NGO has embarked on a peer education program in which the women in sex work act as peer educators and disseminate information about HIV, sexually transmitted diseases, and promote the practice of safe sex. It is emphasized that there is a difference between trafficking of women and children, which is a criminal issue, and adult sex work. Adult sex work should be decriminalized and women in sex work should be entitled to the same legal rights as other people involved in other socially acceptable forms of labor. The unionization of women in sex work is advocated so that sex workers can claim their right to human dignity, liberty, security, and fair administration of justice. The human rights approach yields positive results insofar as such initiatives allow the prostitutes to develop broader identities as activists and demand their rights. A comparison of this approach with the policy approach of the government suggests that legislative or rehabilitative measures would not be the panacea to the evils faced by prostitutes. The socio-economic and cultural backgrounds of the prostitute should be considered. Since most women who are forced to take up prostitution do so due to poverty, have low levels of income and information about good health practices, they are unable to make effective use of legislation and healthcare services provided by the government. Society conjures images of sex workers, which leads to stereotyping and stigmatization. This attitude of the community further aggravates the identity crisis faced by young women in this profession. Therefore, social and legal views cause more harm than benefit to the sex workers. In this discussion, we have analyzed the reasons for the perpetuation of prostitution in India. In the previous lecture, we had looked at the various reasons and the various propelling factors and the luring factors which bring young women to this area. Based on a thorough examination of the needs of the prostitute community as well as the legislative initiatives and welfare schemes being implemented, we may suggest that the government should adopt a policy which emphasizes on greater rights being available to women who are prostitutes. Having examined the positive and negative effects of legalization, it would be reasonable to conclude that such a measure might not be the most effective to control problems associated with prostitution. We can look at a few strategies which can be suggested in this regard. Effective strategies to overcome the problems associated with prostitution are likely to be those which emphasize on the human rights of sex workers and promote collective action to secure their dignity. Prior experiences of NGOs and activist organizations reflect that by enhancing their self-awareness, promoting their right to liberty and security of person, as well as providing active support to women involved in prostitution, the challenges faced by women in prostitution in the form of economic and social exploitation can be overcome. Awareness campaigns propagating information about health-related concerns have ensured increased use of protective measures among sex workers. Access to education will also have a positive impact on various health schemes undertaken by the government, and awareness of human rights will ensure that prostitutes' better working and living conditions are made available. Finally, the recognition of human rights may also help to solve the problems of child sex workers who have been granted protection under the Constitution and numerous national and international legislations. Therefore, we have seen that, like many social problems, prostitution is a problem with many faces. It is a problem which cannot be simply done away with the bang of the gavel. It can also not be done away with by passing legislations. It is a problem which has deep roots in society, and it has various dimensions which need to be properly appreciated before this issue can be dealt with in a proper and beneficial manner.